Cardiopulmonary resuscitation, or CPR, is a life-saving technique. It's also called basic life support, or BLS. CPR helps people who are in cardiac arrest, which happens when the heart stops beating suddenly. CPR keeps blood flowing to the brain and other vital organs, and this can help prevent brain damage and death. CPR is a combination of chest compressions and rescue breaths. Chest compressions manually pump blood throughout the body, while rescue breaths provide oxygen to the lungs. Every second really counts during cardiac arrest. CPR can double or even triple a person's chance of survival. Learning CPR is essential for everyone, but it's especially important for healthcare providers. Nurses are often the first responders in emergencies, so they need to know how to provide CPR quickly and effectively. Mastering CPR requires both practice and knowledge. This guide will help nursing students understand the basics of CPR, and it will also prepare them for the NCLEX exam. Before starting CPR, you must assess the situation. First, check if the scene is safe for you and the victim. Then, check if the victim is responsive. Gently shake their shoulders and ask loudly, "Are you okay?" If the victim is unresponsive, shout for help or call 911 immediately. If possible, send someone to get an automated external defibrillator, or AED. An AED is a device that can shock the heart back into a normal rhythm. Next, check for a pulse. For an adult, feel for the carotid pulse in the neck. For an infant, check the brachial pulse on the inside of the upper arm. If there is no pulse, it means the victim is in cardiac arrest, and you need to start CPR right away. Remember the CAB formula: compressions, airway, breathing. This formula guides you through the steps of CPR. Let's explore each step in detail. Compressions. Place the heel of your hand on the center of the victim's chest. For adults, the correct position is on the lower half of the breastbone. For infants and children, it's slightly below the nipple line. Keep your arms straight and your shoulders directly over your hands. Push down hard and fast at a rate of 100 to 120 compressions per minute. Compress the chest at least 2 inches for adults and about 2 inches for children. For infants, compress about 1.5 inches. Airway. After 30 compressions, open the victim's airway. Gently tilt their head back and lift their chin. This maneuver helps to open the airway by moving the tongue away from the back of the throat. Breathing. Give 2 rescue breaths. Pinch the victim's nose closed and seal your mouth over theirs. Breathe into their mouth for about 1 second per breath. Make sure you see the chest rise with each breath. Continue cycles of 30 compressions and 2 breaths. Do not stop CPR unless the victim shows signs of life, an AED is available, or emergency medical services arrive. CPR for children and infants. The basic steps of CPR are the same for adults, children, and infants, but there are a few key differences. For example, the depth of compressions is less for children and infants. When giving breaths to an infant, cover both the nose and mouth with your mouth. Automated external defibrillator, or AED. An AED is a life-saving device that can analyze the heart rhythm and deliver an electrical shock if necessary. Using an AED is very simple. Turn it on, follow the voice prompts, and apply the pads to the victim's chest as shown. Choking. If someone is choking, perform abdominal thrusts, also known as the Heimlich maneuver, to dislodge the object. For pregnant or obese individuals, chest thrusts may be more appropriate. Pregnant patients. CPR for pregnant patients is similar to CPR for other adults. However, it is crucial to displace the uterus to the left to improve blood flow. This can be done by manually pushing the uterus to the left or by placing a rolled towel or blanket under the right hip. Remember, CPR is a vital skill that can save lives. By understanding the steps of CPR and practicing regularly, you can be prepared to act in an emergency. Always remember to assess the situation, call for help, and follow the CAB formula.